Insulin resistance is a medical condition finally getting the attention it deserves. But what do you need to know about it, and what can you do about it? I'm Dr. Brett Scher, the medical director at dietdoctor.com. And I got to be honest, when I was in medical school and residency, I didn't hear much about insulin resistance or learn much about insulin resistance. It was all about type 2 diabetes. You either had it or you didn't. So one of the great things about the recent attention on insulin resistance is it's something that we can address before people get type 2 diabetes. And if we can diagnose it and address it and reverse it, then people might never go on to get type 2 diabetes and can dramatically improve their health. So I wrote a guide that we recently republished since it's been medically reviewed by Dr. Michael Tamber. And so we republished it at dietdoctor.com. I encourage everybody to go read it because it has a lot of the details and references about insulin resistance and what you can do about it. But I wanted to touch on some of the important issues here in video format as well. So for starters, insulin resistance, unfortunately, is pretty prevalent. And the NHANES data, which was back in 2006, showed a 34% prevalence in the United States alone, with probably a similar prevalence in Europe. But that's only been increasing since then. And for people who are obese, it's over 50% in adolescents and over 70% in obese women with insulin resistance. So you can say, well, why does it matter? Well, because insulin resistance is also linked to increased risk of cancer, increased risk of neurodegenerative conditions like Alzheimer's disease, increased risk of heart disease. So it may not be a clear cause and effect, but certainly increased risk of and association with. So if there's any chance it's related, you want to really cut that down. And of course, increased risk of type 2 diabetes, something we all want to avoid. Well, how does it start? Well, what is it? Basically, insulin is critical, right? We need insulin in our bodies because it regulates our glucose. As we eat, our glucose goes up, so our insulin goes up to bring our glucose back down. It's what we call a homeostatic mechanism that sort of stays in line and in order. But the problem is when we keep eating, insulin has to keep going up. There's constant calories, constant glucose in our system that needs to be addressed. Our insulin chronically stays high. And there comes a point where our body sort of says, I can't listen to this anymore. There's too much insulin around. I can't keep up with the workload. It's anthropomorphizing our cells, but basically it's a good analogy of what happens, that all of a sudden the cells can't respond to the insulin as well. So what happens? Well, the blood sugar can then start to rise. So we have high blood sugar and high insulin, which is a pretty dangerous condition because it leads to high blood pressure. It leads to type 2 diabetes, and it can lead to all these other conditions I'd mentioned previously. Now, what's the actual underlying cause? And here's where I think this is really interesting, because what the science shows is it's fatty acid accumulation in our muscle cells, and in our liver cells. So fatty acids, fat. So that's where a lot of people say, okay, so it's a high fat diet that causes insulin resistance. But hold on. When we look at the evidence, there is some evidence that saying a high saturated fat diet is associated with insulin resistance. But as usual, this is a high fat, high carb, high calorie diet. So in that setting, that type of diet can be related to insulin resistance. But you know what else is? High sugar, high fructose in the setting of a high calorie diet. But what about a low carb, high fat, not high calorie excessive diet? There's no evidence that that's related to insulin resistance. And in fact, there's evidence that can treat and dramatically improve insulin resistance. So I think that's so interesting because the knee-jerk reaction or the catchy headline is fatty acids in your cells, fat in your cells cause insulin resistance. Therefore, it's eating too much fat. But no, that's too simplistic, and the body doesn't work that way. So it's caloric excess of any kind, and it's increased sugars, increased fructose, and then probably saturated fats too in the setting of a high caloric diet, right? But with a low carb, high fat, high saturated fat diet, absolutely no evidence that causes insulin resistance. So that's an important point to make. Now, we talked about symptoms in the guide as well. There really aren't many symptoms, just like with type 2 diabetes. There's not many symptoms. So it's something you need to sort of be on the lookout for. And it's associated with abdominal obesity. So a simple tool to measure is sort of the height to waist ratio. And we talk about that and show you how to measure it and give you some guidelines in the guide on what to look for. But really, you have to sort of be on the lookout for it. So there are some lab tests you can ask your doctor about. There's the triglycerides are very important because they can be associated with metabolic syndrome and insulin resistance, as is fasting glucose, or at that point, if your glucose is already high, sort of the cat's out of the bag, then you've already got prediabetes or type 2 diabetes. But trying to catch insulin resistance before the glucose goes up, and that's where a fasting insulin can be helpful. Now, there is some natural variation in fasting insulin, but a very high fasting insulin, like we see patients all the time who have normal blood sugar, normal A1C, but a fasting insulin of like 30 with abdominal obesity. And it's clear that person has insulin resistance and needs to be addressed. So fasting insulin is a good one. A Kraft test is also a good one. That's it's like a glucose tolerance test with insulin. So you drink this nasty 75 gram carbohydrate mix, and then over the next anywhere from 2 to 5 hours, depending on how detailed you want to get, you measure your blood sugar and insulin levels to see how that tracks over time. But some people would argue, well, you don't even need to do all those. If you've got abdominal obesity and you've got a high insulin level, you know you've got insulin resistance and you need to address it. Now, how do you address it? Well, you reverse the things that cause it. So caloric excess and abdominal obesity cause it, so you try and reverse those. High sugar, high fructose can certainly cause it, so you try and eliminate that, right? So that's where following a low-carb diet that is not in caloric excess, which most low-carb or keto diets aren't because they're naturally satiating, those diets can be very beneficial for treating and reversing insulin resistance. So again, it's not that they're the only diet that can do it. There are plenty of other diets that can, but finding a diet that works for you, that helps you feel full, that allows you to do time-restricted eating, which addresses insulin sensitivity very well, and allows you to feel satiated and enjoy your meals and that you can stay with long-term, that's the key. And in a way that's going to lower your insulin, lower your sugar. So that's why I'm such a big proponent of low-carb diets and time-restricted eating, specifically for insulin resistance, because I've seen it work for so many people, and the evidence supports that it does work for that. So if you want to learn how to get started on this, we'll share links to our 2-week keto challenge, or even our 5 weeks of keto with Christy. A very easy way where we're going to walk you through the process to show you how to start on a keto diet. And again, it may not have to be a keto diet for your whole life, but I think it's such a great way to start for a lot of people. And then you can determine if you want to back off to a more liberal low-carb diet or stay with a keto diet, depending on your results and how you progress. But it's such a powerful method for treating insulin resistance, as is time-restricted eating, and we'll include a link down below to our time-restricted eating guide as well. So that's a lot of information. I hope you can process that. Ask yourself the question, could you be at risk of having insulin resistance? If so, talk to your doctor about it and see what you can do about it. Hopefully some of these tips will help. All right. Take care, everybody. Have a good day.